I started this work when I was at Sutter Health. I wanted to bring it to Providence. It's been a journey for me to learn about, I'm a critical care physician by training. So to learn about perioperative care and surgical care, I've had a couple of years good experience as an administrator working in this space to help improve our operating rooms. As part of that, I had a lot of experience traveling to different hospitals and seeing how they were set up, what their keys to success were. And I saw hospitals that succeeded and those that failed. And so I built a strategy that I want to use here in the hospitals at Providence that I have the chance to work at, and in advanced care for surgical patients. There are 5 domains that you need to improve. People domain. What is the right staffing? Do we have the right people that are trained nurses in the right space for the type of program we have for cardiovascular surgery, for neurosurgery, for robotic surgery? And you need the right trained people and the right administrative staff as well. Do you have supervisors, managers, OR directors? Get the right people in place, that's critical. Second domain, process of care. It's not enough just to have an OR, schedule cases, and allow surgeons to do their thing and come and go. There has to be processes around how you run an operating room. And I mean standardized processes. The better your operating room functions, it functions like it should function like clockwork. You want it to be starting on time. You want every case to have a predicted amount of time it's going to go. You want turnaround times that you understand and measure between each case so that you're efficient. And this includes standards for EVS and bringing supplies and equipment back into a new OR that has to be turned. You need processes of care around scheduling cases, planning them for the day. All these processes need standard operating procedures. And so these are built over time. I'll explain why, again, time is important in just a moment, but process is the second domain. Tools and technology. You have to have the right equipment in place to make this work. Not only physical equipment, the instruments to do surgery, but I mean, Epic and modules in the electronic health record, if you don't have Epic, that are designed for surgical operations. Very good technology today exists for that purpose, and that allows measurement. So we can see how effective we are in certain spaces or where we need to improve based upon data that comes out of the electronic health record. All that data won't do any good unless you have the fourth element, which is governance. You need an operating room that functions in a well-governed fashion within a health system and within a hospital. At the hospital level, we should have a surgical executive committee that should be populated with frequent users of the operating room and leaders, administrative leaders, infection control individuals, quality improvement individuals, that sets a path and where you want this operating room to go and how it should function and detects problems early where it's broken. And then lastly, embedded in all my comments, I think, is this notion of metrics. We want to be able to measure that we're succeeding in all these spaces. So that's the fifth domain. The program I'm trying to advance says, well, look, those 5 domains exist, but as I said to you earlier in this conversation, you have to meet people where they're at on their journey. And so I've created a 4-phase development strategy. The first phase is baseline, which is essentially manage chaos. Moving up to developing is the second phase. Third phase is a mature system. And the fourth phase, optimized, meaning it's running it with high efficiency.